There are a variety of clinical trials going on right now, including trials for knees and tummies. Here with more about these trials that are being done right here in Phoenix is Dr. Joseph Gimbel with Arizona Research Center. Good morning, Doctor.
Good morning. Good to see you.
Let's talk about this knee study because this is really interesting. You're really compensating your patients for this.
Well, we compensate our patients for all the trials, but this is a little more than we usually compensate. Patients can make between $1,200 and $2,200 for participating in this trial. And what this trial is, it's interesting because most people get cortisone shots when they have arthritis. It's very common, and it lasts maybe 3 or 4 weeks. This is a time-release product, so patients are going to get up to maybe 3 or 4 months worth of pain relief from this cortisone product. And they would have to stay at our facility for 2 nights and 1 day, and then with follow-up visits. So we do compensate them up to $2,200 for participating for their time and travel in this study.
That's really great. I know a lot of people probably perked up when they heard me say tummy tuck study. Tell me about this one.
Yeah, that's a very popular study, as you can well imagine. We get lots of calls. But this is a study where patients will get a tummy tuck. A plastic surgeon is the one that does it. I'm an orthopedic surgeon. Obviously, I'm not doing tummy tucks. But so the plastic surgeon does the procedures, and we keep you in our facility, treat you for your pain till you're comfortable, and then you go home. We compensate you also in an area of about $500. But the procedure is free. There's no charge to the patient to have this. And what we do is we actually are evaluating a narcotic-free medication.
Oh.
And if patients don't get relief, then we switch back to the regular pain medications. So we don't keep people in pain, but we are trying out these new medications to see how effective they are following the surgery.
You're also doing some studies on back pain because that affects so many people.
It's very, very prevalent in the community. A lot of people with back pain, and they're very frustrated because they've gone through a lot of treatments and they don't work. We do have an epidural study with a long-term product. It's a long-term cortisone product. So patients, again, are getting extended relief from this product. And this is actually this would be the first product approved by the FDA, a cortisone product for epidural injections. We also have another product which is quite interesting for back pain. And patients will get this similarly, but it's a clonidine product that lasts for a significant amount of time, and patients are getting up to a year's worth of pain relief, which for back pain is quite unusual.
Yes.
So we're really excited about that in order we can give patients hopefully a lot of relief from their back pain.
And let's talk about your stem cell programs.
Well, we're actually starting a study probably in the next couple of weeks. This is one of the only FDA-approved studies in the country for stem cells. If you go on the FDA website, you'll find that there are a lot of products that are not approved. They're actually closing down a lot of sites. Patients are being charged $5,000, $6,000, $10,000 for stem cell products that have not been proved to be effective at all. So this is an FDA-approved product, and we're using this. We're taking your own fat cells, taking the stem cells from your own fat cells, so it's not taking it from anybody else. And we're using those stem cells for rotator cuff problems.
And right now we're seeing your current enrolling studies right here, the knee study, the PRP, back pain, and bunion removal, as well as the tummy tuck that you're saying that is very popular. And tell me about the Refer a Friend program that you have.
Well, obviously we have multiple programs. So if you call and give us the name of a person who wants to be involved and you refer them, then we would compensate you $100 for that referral. And surprisingly, we have a lot of people that are doing this, and we're paying them. Obviously they're sending us a lot of patients, so it's a way for people to have, to send their friends and to actually, we're happy to compensate them if these patients do participate and enter the trial.
All right, Dr. Gimbel, thank you so much. A lot of great information, and if you want to learn more, you can always visit their website, azresearchcenter.com, or call the number on your screen.